I'm Carolyn Merriman, and I am going to give you a few tips on how to be a more successful test taker in this presentation. So, as nursing students, you have opportunities to practice and use critical thinking. And so that's the kind of testing that we as faculty want to provide for you, is opportunities on our tests to do more than just answer rote memory questions, but to also do some critical thinking. And we also want to prepare you for the NCLEX RN, because that's the ultimate goal for you, is to pass that the first time. And so if we can help you do that through providing critical thinking questions during the nursing program, that would be a wonderful thing for you. Ultimately, however, we want you to be competent nurses. And so by practicing critical thinking questions now and being able to master them on nursing tests, also the hope would be you will be competent critical thinkers in practice, which is, of course, a desired goal too. So that's what critical thinking is all about, and that's why we apply it to nursing tests, and that's what makes nursing tests different than any other test you've already done. There's all different levels that may be listening to this, but that is an introduction to why we use critical thinking in nursing. So I want to entertain for you that there are 4 C's to becoming a better test taker. And I'm going to write that on the board. There are 4 C's to becoming a better test taker. And these 4 C's came out of an author with the last name of Rowland, and her book was called Soar to Success on Nursing Tests. And so I've used her template, and then I can expand on that. But the first C to becoming a better test taker is to really study the content. And that sounds really easy, but depending on what kind of learning style you have will depend on how you use this concept well. Do you like to study in groups? Do you like to study by yourself? Are you a hands-on learner where you take notes and use flashcards? Do you like to listen to video recordings like this, or have video record your faculty? All of that has to do with knowing the content. And I also want to emphasize that you should not wait till the day or 2 days before a test. If you can get to know the content as you go in nursing, it will help you so much more. There's a ton of reading in nursing texts, and so there's a whole strategy that we could talk about as far as how to become a better reader also. But you try to get a hold of and read as much of the content in the textbook, not just using your testing books like ATI, but actually using your textbooks and trying to review the content so that when you come into class, you can maximize your time in class, that you can be an active learner, engaged and ready to ask your faculty questions. That's what it means to get to know the content. So study all along. Look at the objectives on your syllabus and don't wait till the end before the test is 2 days away and say, oh my gosh, I've got to cram and study. Nursing knowledge is more than just cramming. Understanding the concepts and building on them is what's really going to help you in the end. So that is content, and that is our first C. The second C of becoming a better test taker is control. And so you have to ask yourself, who is in control of this test situation? Am I going to take control of my anxiety, or am I going to let the test take control of me and not be able to perform? I have studied the content, I am really ready, but some of you go, oh, the test never reflects what I know because I get so anxious. So don't let the test control you and how you handle this testing situation. So what can you do to get control of your anxiety? Well, there are some mental things that you can do, and there are some physical things that you can do to get to know and to control your anxiety. So mentally, you have to say to yourself, I am ready for this test. I am going to be an excellent RN. I am studying, I've learned, I've done the content. So those are some of the mental things. It sounds like mental games, but it's more than that. If you have indeed prepared, taken the time that you need, studied the content you need, then you can just take more control of your anxiety, those games that you play in your head. Say no to anxiety and say yes to success by doing these things. Physically, what can you do to control your anxiety? Well, some people say that if you study at the same place all the time, if you've given yourself enough time for time management, the more, the less prepared you are for a test, the more anxiety you'll have. So don't let that get in your way. Do not procrastinate. Start with the tough stuff first, the stuff you don't know first, and then set it on your calendar. How am I going to get ready? Put it down on a calendar. The more prepared you are, the less anxious you are. But there are also some other physical things you can do to control your anxiety. You need to prepare by getting enough sleep. It's not helpful to stay up till 3 in the morning the day of the test and trying to say, oh, this way I can study more. Get some sleep, eat a solid breakfast, and then get up and come to the testing situation. Now, you know as well as I know, there are some people that are anxiety sweaters. You get around them and they start jabbering about the test and they make you more and more anxious. You need to avoid those people the day of the test. You need to come into the test on time, but don't wait out in the hallway where everyone is anxiously talking about, well, did you study this or did you study that? That's not going to help your anxiety. Come in, find your seat, get away from people, and then close your eyes. Physically, you can close your eyes. Take a couple of good cleansing breaths and just try to focus again on, I am ready mentally. I've studied. I'm going to do my very best. And then let go of some of that anxiety. So taking some deep breaths actually will clear your head. It brings more oxygen to your brain. Some people use that time, that reflection time before a test when everyone else was jittery, to actually just relax. Some people use it to pray. Some people use it just to clear their mind. And you know, you can't, if prayer is part of your value system, it's not to pray, give me things that I haven't studied. It's to say, help me be clear-headed here, and do the best that I can do and show what I know. Sometimes during the test, we have to take control of our anxiety. You might get to a question and you're going, I have no clue about this. Well, don't let that one question throw you off. Take a deep breath. You're in the learning mode right now, so it's not like NCLEX that you can't go back to this question. So you can go back, mark it, flag it, and then move on. That one question should not unsettle you. The same thing when you get to NCLEX, however, where you can't go back. Don't let one question just totally make you so anxious you can't function. Take a deep breath, use some test-taking tips, and then move on and let it go, like that song in Frozen. So we have content, we have control. If you take control, then you're going to be a better test taker. Then we have the third C of becoming a better test taker. And some of you are probably guessing correctly that that would be confidence. If you have studied the content and you have taken control of your anxiety, you will come in to the test with more confidence. You should study. During the study mode, you should be studying for that 90% or above, or if it's for NCLEX, I am going to pass it the first time. Or you should also, that's confidence, and you should come into the test with confidence. This sounds a little bit like, well, I don't know, but you might want to dress for success. The day of the test, instead of coming in on your pajamas like you've just crawled out of bed, dress for success. Put on some clothes that make you feel like I am going to work. I've got this job to do. It's going to be to pass this test at the 90% or above. So I want you to know that it's an awesome goal to think 90% or above on every test then if you get an 85, you're going to be okay with that, but you might get a 95 or even higher. The other thing you could say is, if it's not just a test about percentages, like ATI, I am going to get a level 2 or 3 on ATI. Make that your goal when you're studying. And certainly when you get to NCLEX, say to yourself, first time or bust. I am going to pass this the first time. And every test builds. And of course, the NCLEX is the ultimate test that says I can go into practice and be the nurse that I want to be and have that license and show that I am competent to take care of clients. So we have content, control, and confidence. And I just want you to say to yourself, I am worthy enough. I am good enough. I'm going to be an awesome nurse. And it wouldn't even be a bad idea. No one is going to report you to the State Board of Nursing if you go and put down your name and put down RN behind it, because this is your future. You are going to be an RN. And so put it on your dashboard, put it on your mirror, and remind yourself that that's the goal and that's where you're heading. So we've got these 3 C's. Let's talk about the final C. I'm going to have to move over on my board. And the 4th C of becoming a better test taker is common sense. Common sense. And this common sense is where we get into test-taking strategies. How do I become a better test taker? If I've done the content, I've taken control, I'm coming in with confidence, is there something I can do that's actually test-taking skills that will help me master the test? So common sense really has to do with test-taking skills. So when you approach a test question and you're not exactly sure what to do with that test question, some of the things that you can do and say to yourself would be, I would separate it. First thing you're going to do is say, what is this question about? What is this question about? And that's the scenario. That is where you're going to look at it and say, okay, I want to know who the patient is. Are there any diseases this patient has? Are there any numbers in the question that are important? Numbers like how many hours post-op are they? How many hours since their last pain medicine? Are there any lab values that are important? Those are all part of the scenario that's getting you ready for this test question. And that's what the question is about. And then the second thing you should say would be, well, what is this question? This is what it's about, but what is it asking? Now, what is it asking me to do as the test taker? What is this question asking me to do as a test taker? So what I'm doing first is separating, okay, I'm learning what the question's about. Now I'm going to say, what's it asking me to do? And that is called the stem of the question. The stem of the question is usually the last statement or question before you get the options, the 4 options. So ask yourself, what is it asking me to do? Now you all in nursing are very familiar with scenario. It could be something like you have a client that has been in a motor vehicle accident and they've hit their head. They're bleeding, they're throwing up, that kind of thing. They rate their pain as 6 on a scale of 10. That's all the background information. And then here comes the focus. The focus is the stem, and the question will say, what is your nursing priority with this patient? Or what is the intervention you're going to do first? So that is the stem. The stem is the question or the statement before you have to figure out what options there are. And it's important to look at the stem. The third thing you should do as part of this common sense test taking is then ask yourself, is the stem a positive stem or is it a negative stem? Now, I just gave you an example of a positive stem. A positive stem says, what should the nurse do? Or what should they prioritize? Or when is teaching effective? Those are the kinds of words you're going to hear for a positive stem. For a positive stem, there's one right or best answer, and the other ones are either wrong or they're just not as high a priority. So that's what a positive stem can do. Now, when you're looking at a negative stem, sometimes it's easy to misread a question, and that's what students have a problem with sometimes. So a negative stem is saying what would be something that the nurse should avoid, or what would have the least a priority. Or another way of writing this is, more teaching is needed when a patient says something. Another example would be something like, the nurse should question a doctor's order or a lab value. So for a negative stem, you're looking for the wrong answer or principle to be the answer for your question. And so that's an important thing to look for. Now, by really reading carefully the test question, it's going to help you figure out what the scenario is, figure out what the stem is, and if the stem is positive or negative. That's just the start. Then the next thing you should do when you're doing test-taking strategies is figure out what are the key words in this question that's going to really help you focus on that question and on what the answer should be. So key words could be in the scenario. In this case, the person that had the motor vehicle accident and bumped their head, if they're bleeding and they're vomiting and their pain is 6 out of 10, all of those are very central words that I might want to highlight. And then when I ask the stem, the positive stem that says, what would be the nurse's priority? Then in my head, I'm thinking a key word is also priority. So priority words that's going to really help you, or key words that's going to really help you know what this question is asking you, it would be things like best, priority, first, effective teaching, all those things that will really help you hone in and focus on what that question's about. So in your head, or highlight if you've got a paper and pencil, know the key words. And then the next thing would be, and this is an important one, then try to reword the test question. The test question. I call this owning the test question. So you reword it and say, what is this question really asking me to do as the test taker? So I would reword that scenario I gave you about the emergency room and say something like this. What is the first thing or priority I'm going to do for someone that's hit their head and is in my emergency room and they're bleeding and throwing up and they're in pain? I would bring it all together and talk about this question in my own words. So that's called rewording the test question in your own words and owning it. Okay, so after you've reworded the test question, you've got another step. First is separate the scenario from the stem. Ask yourself, is the stem positive or negative? Identify the key words, and then reword the test question. Now you're ready to eliminate some of the options. So the next thing that you're going to do is you're going to look and say, can I get it down to 2 options? So number 6 on test taking would be eliminate at least 2 options. Now this is of course for a 4-option traditional test question, and in nursing we have some other kinds. But eliminate at least a couple of the options that don't answer the question of what would be my priority action for someone in the emergency room that's hit their head, they're bleeding, they're vomiting, and they've got pain. So I'm going to eliminate the options that are just not as important. When you get 2 options down, for instance, there could be something about stop the bleeding, give the person an antiemetic, check their neuro status. If they've hit their head and they're vomiting, maybe they've got something going on neurologically. Support the person's family. So, of course, according to Maslow's hierarchy, we do the physical needs before we do the psychological needs. So whenever you're using any of these test-taking tips in nursing, I want you to think airway, breathing, circulation, and I call this the ABCs because the S is safety and then pain. pain might go out there. But ABCs, is the person's airway opened? Are they breathing? If there's an option about that, that's where I would go. If there's no option about airway or breathing, then the next thing has to do with circulation. Is there any bleeding going on? If there's bleeding going on, I have to deal with that. If there's not any airway, breathing, or circulation issue, is the patient safe? Physically safe first, and then psychologically safe. So when you're doing test-taking strategies, remember your ABCs, and remember Maslow's hierarchy, which says physical needs before psychological. So of course, before I support the family and take care of that patient's psychological needs, I've got to make sure that they're not bleeding, that their level of consciousness is okay, and even their physical GI issues are okay. So I'm going to eliminate options based on the ABCs. I'm going to eliminate options based on Maslow's theory. This is the world of NCLEX and critical thinking questions. I'm going to answer. I'm going to say, well, I'm going to reword the question and answer it with the two options that are left. So answer the question with the two options that are left, and see which one makes the most sense and also addresses the ABCs and Maslow's hierarchy. So let's say that I eliminated supporting the family and giving the person something for nausea. And what I have left is checking their neurostatus and stopping the bleeding. Those are the two things I have left. Then what I would do with my scenario is say, I have a patient in the emergency room that hit their head and they're bleeding, and they're also, and they hit their head and they're bleeding, nausea, that kind of thing. Is it the priority for me to stop their bleeding, or is it the priority for me to check their level of consciousness to see if they're alert and oriented? And in the case of airway, breathing, circulation, neurostatus is very important. But if the person bleeds to death, they're dead, and it doesn't matter if they're alert or not because their blood, they've gone into shock. So that trumps, bleeding trumps neuro in most cases. Bleeding trumps neuro. People could argue, and that's a fine line, but that's how our ABCs work. So I would pick then that I've got to stop the bleeding as my priority. After you've asked the question again, and you've gotten the two options, then the final thing you're going to be doing is answer the question. Answer the question with the answer that you've chosen as the priority. And then what I would really suggest to you is go with that question. There should be very few times that you go back, change your answer. What people start doing as soon as they've gone through this process is they get very self-doubting, and they start doubting themselves, and they go, well, what if? And what if is a very dangerous statement. Do not go what if. Go with what you chose. After you've done this process, you've eliminated a couple options, you've reworded and taken the question and handled it yourself, then go with that question and don't go back. The majority of the time that students change their answer, the majority of the time they change it to the wrong answer. So a couple of things I want to tell you is that this test-taking strategy of identifying the question and really thinking about what the key words are and what the question is asking you to do as the test taker has been known to really help students through the process of taking tests. So I wanted to just share some of these ideas with you. Remember that the 4 C's of taking tests are studying your content, taking control of your test anxiety, both the physical and mental things that you can do. Come into the test with confidence and own that test, and then do some common sense test taking if you need to through these strategies. I hope you practice these strategies. I hope this video has helped you with some of the basics of taking tests, and I wish each of you success on your tests, not only in nursing school, but on NCLEX, so that you can be the fine nurses that you're supposed to be. Thank you.